Good afternoon, everyone. I'm delighted to be here. How many of you can tell me how many times you swallow in the course of a day? I can almost see hands out there, and I don't see many. Then again, why would you know? Why does it matter? That's an autonomic response, right? Our body runs on its own. It's on automatic pilot, just like blinking and breathing and coughing and sneezing. We don't need to know how to make it work. It's between 15,000 and 25,000 a day, by the way, 3 to 16 times per minute. Who knew, right? But we don't pay attention to it. It's one of our life-sustaining functions, and we have no idea how it works until it doesn't. And that's what I'm here to talk to you about today. As Greg said, I'm a speech-language pathologist. We teach speech, language, and swallowing, as I always say. Speech, which pertains to voice, diction, articulation, accent modification, and the fluency disorders known as stuttering, cluttering, and lisp. We also teach language. That has to do with how you put your words together, and that involves attention, memory, problem solving, sequencing, and of course the executive function of planning. Finally, we treat dysphagia or dysphagia, which is swallowing disorders. You can say dysphagia, you can say dysphagia, tomato, doesn't really matter. Just remember that it's with a G. That's important, that it has a G in it. Now, the thoughts I want to share with you today in the spirit are three. The first is that eating is one of life's great pleasures. No one should suffer in the process. The second is that your mouth is your first and your last frontier. Stop and think about that for a moment. As babies, everything goes into the mouth, right? Isn't that the way by which we explore the world? They explore the world around them. And finally, I hope to leave you with a greater understanding and appreciation of what it means to swallow and eat, and a heightened awareness and compassion for those who choose not to. First, we're going to start a little bit on swallowing. I'm going to tell you how swallow works, okay? Swallow begins in the brain. It starts here, gets the help from the senses, vision, and so forth, but it's the brain talks to the stomach. They decide that you're hungry, you need nutrition. So the brain goes after it. It decides what you're going to eat, how much, how quickly, and how it's going to deliver it to your mouth. And once it gets it in the mouth, your lips seal, okay? You with me? And the teeth start grinding. It's like a mini food processor. And then the tongue excretes saliva. The saliva rolls it around, rolls the food around, forms it into a ball. That ball is what we call the bolus. The bolus gets pushed back like the spatula. The tongue is like a spatula. It pushes the ball to the back of the throat. It hits the nerve in the back of the throat, which sends a message to the brain, which says, red alert, all hands on deck, like a submarine about to submerge. It sends a message down to the laryngeal mechanism, says, come on up, protect the airway, we got a swallow in course. Who knew? Didn't think about that, did you? So now you try it. Work with me. I can hear somebody laughing. Work with me. Put your hands on your throat and swallow. Did you feel it come up? You feel the gentle rise? Were you aware of your tongue excreting saliva and balling in the center of the tongue to start the swallow process, push it back? Isn't that neat? We don't think about that. That gives you something to do at night when you can't sleep. Okay, now, and another thing, for all of you who are still popping your pills and drinking bottled water and throwing your head back, I know you're out there, I'm not going to ask for a show of hands, don't do that. There are very few absolutes in life, ladies and gentlemen, but this is one. Never, ever put your head back when you're swallowing. Do you know why? It leaves your airway unprotected. It may work for you now, but I'm telling you, going forward, you're going to have a problem. And if it starts going down your airway, that can lead to all kinds of complications and aspiration pneumonia. And you don't need me telling you about that. You know about that anyway. Am I correct? Okay. And also, another reason people get tired when they eat is because in that moment when the epiglottis flips over your airway to redirect everything, the bolus into the esophagus and down into the intestinal tract, you actually stop breathing. You experience apnea for that brief second. But for people who are older, people who are compromised, that's why they get fatigued. All right, now, we're going to talk about swallowing disorders. People who can't, people who don't, and people who won't. That's how I divide them. People who can't have some physiologic impairment. Think GERD, think osteophytes, think something physical, some problem. a physical problem. And that can sometimes be mediated by therapeutic exercise, therapeutic treatment, sometimes medication, dietary or positional changes, which, by the way, is the purview of the speech pathologist. Sometimes medical intervention will help. The famous procedure. There are a lot of them out there. The next type of swallowing disorder is the don't. Don'ts, think psychiatric, think psychologic. Psychologic more than psychiatric, psychologic. And that would be anorexia, bulimia. How about depression? That's where the swallowing problem starts here, right? And of course, we have the moderate level dementia, the dementia patients. A lot of times they'll hold food. They used to ask me to evaluate all the time, I think she's holding food. I'd go down there and look at her and say, yep, she is. There's not much you can do because as you were explained, as Teepa said, with the prefrontal cortex, there's not that association anymore. The sensory nerves are gone. They might not even realize that the food is sitting there. And even if it is, they might not have a clue on how to get this to work with that to get it to go back in the throat. So that's your don'ts. And it's very important to understand what's wrong before you try to fix it. Which leads me to my next group, the won'ts. The won'ts are by far the cause of most concern because they're the least understood and the ones that are most in need of our protection. People don't die because they stop eating. They stop eating because they're preparing to die. How often have you heard anybody say this to you? We don't talk about this much. But you know, it's okay that people stop eating as they're preparing to die. We just don't give them permission to do that. I'm going to tell you a story about a friend of mine. Her name is Tony. She called me one morning, hysterical. Her mother wouldn't eat. She couldn't swallow. We didn't know if she wouldn't eat, if it was a can't or a don't. She didn't know. But she said she stopped eating. She couldn't swallow. Let me tell you about Tony's mother. Tony's mother was 96 years old, 14 years post-diagnosis of Parkinson's disease. She had lived for the last 10 years 24/7 care in her own home on the first floor. Somehow she fell, the famous 4-letter F word. She was taken to the hospital. In the process of trying to pick her up, however, they broke her neck. So now she's in the hospital and she's not eating. And Tony's beside herself because she said, I don't know what to do. I can't just watch my mother starve to death. Well, starving is a very emotionally charged word, and it's not to be confused with not eating. There's a difference. So I explained to Tony, she hadn't seen the doctor, she hadn't seen a speech pathologist. I'm sure there were a lot of people there that knew, but nobody started the conversation with her. But I told her that her mother, under no circumstances, would starve. And she was surprised. And I said, what would happen is that the sodium would take over. She'd become dehydrated, her values would go off, the sodium would take over, and they'd push her mother into a type of euphoria. It would be a fabulous trip, the kind that people paid big bucks for back in the 60s and the 70s. You know, huh? So she started to laugh, which was good, because in laughing she started to relax. And when she relaxed, she could understand, she could hear what I was saying. And the issue that I have with all this is that this is not a new scenario. Everybody in the medical unit knew what was coming down on this. Anybody could have spoken to her. Somebody should have, but yet nobody did. And I believe that no one should suffer that angst when we have information that we can share that can help make life better for them, especially when they're dealing with the end of life. So I say to the physicians and I say to my colleagues all the time that medicine is not exclusively about treating and curing. It's about educating and preparing people so that they can make an informed choice. On another note, my mother was a consummate animal whisperer. One day she brought home 4 baby raccoons. Their eyes were still closed. They were adorable. Apparently the mother had been killed in a trap. You don't care about that, but I'll tell you anyway. So we weren't very skilled in the science of raccoon rescue, but we knew that they had to eat every 3 hours. So my mother, father, and I went out, we got the pipettes, we got the baby bottles, and we set about feeding them every 3 hours. And as I said, we weren't knowledgeable about this, and there were three little boys and a little girl, and 2 of them would perish because we didn't have strong enough pablum until we got it right. 2 did survive, and it's a lovely story. See me later, I'll tell you about it. It's beautiful. But anyway, it really is cute. Anyway, this little guy, the first little guy, was in the throes of dying, and my father and I were desperately trying to give him nutrition, because that's going to fix it all, right? Get him to eat, they're going to live forever. My mother shook her head in sadness and she said, I don't understand why you are force-feeding a creature that is simply trying to die. Make him comfortable. Don't make him struggle. Let his last few moments on this earth be peaceful. We did that for him. Would that we could do that for the human beings around us. Which leads me to my next concern with regard to the treatment of wounds. There is a pharmaceutical on the market known as atropine. Are you familiar with it? Some of you may know it. Sometimes it's in the hospice kit. Atropine is an ophthalmologic drug. It's a droplet. It's used to dilate the pupils. It's also known by the term belladonna, beautiful woman, because of the effect it has. It dilates the pupils like somebody who's starstruck and madly in love. They've also authorized it for use in germ warfare. They use it for in injectable form for airway patency. And they've authorized it sublingually for use in hospice. And I presume that they're using it for the same reasons. Airway patency, I know they're using it for the death rattle, and they're using it for secretion management. And here are my issues. First of all, there's a very low level, according to the research, a very low level of respiratory distress in dying patients. With regard to the death rattle is when secretions get caught in the hypopharynx, and it has that gurgly sound. It sounds like somebody's underwater, and you just want to pull them out. You want to fix it. And there doesn't appear to be any pain associated with that in the patient. However, it's unnerving to the caregivers and the people around them, the family members. So the push is to fix this. However, the scientific evidence does not in any way support the efficacy of any of the interventions that we're using on the death rattle. For those of you familiar with the death rattle, were you aware of that? This is huge. So my question is, why are we still giving it? But my even bigger concern is the issue of secretion management. Now, I happen to know that death rattle that you're hearing is not just the result of somebody swallowing. We've got multi-system failure going on. Let's be reasonable. We've got congestive heart failure. We've got pleural effusion, pulmonary edema, one or all of the above. Who knows what else is involved in that? And yet we're trying to dry this up. We're drying up by putting those drops under the tongue, directly under the tongue. That's where your salivary glands are. You all just swallowed. You know, listen to me, you know how hard it is to talk when your mouth is dry. You've fallen asleep with your mouth open. It's horrible. So when we do that to them, we are drying up their salivary glands. We are making it impossible for them to initiate a swallow reflex. And we're depriving them of the choice. You know, that's the last choice many of you will make in this world, the choice to swallow. Long before they've bathed you, changed you, dressed you, gotten you up, put you to bed, the last choice you'll ever make, many of you in this room, is to swallow, because nobody can make you do that. And yet we deprive people in hospice with that when we administer that atropine under the tongue. So all I'm saying is I think that we should really reconsider this, because I don't think it's comfort care or quality of life, and we need to be a little bit broader in our approach in how we can make their last minutes here more comfortable. In summation, I would like to say that we as healthcare professionals must educate and inform. We are obligated to educate and inform those we serve so that they can make a more informed and timely decision. We have to do this on a timely basis. And if we wait until they need to know it, it's too late. We need to get into those wellness programs, those corporate programs, and start talking about this long before people ever have to make this decision. As a culture, we have to learn to accept the concept of finality. We have to learn to embrace this. Nothing is forever. Sometimes there ain't no app for that. You can't fix it. And even if you can, it doesn't mean you should. Finally, as human beings, we must respect and honor these final chapters as they are being written. And we must help others, and family members in particular, to do so. People do not die because they stop eating. They stop eating because they're preparing to die. And we must respect this. Thank you for being my audience.